Orthognathic surgery is where there's been a growth and development issue between the upper and lower jaws. And basically what happens is either the upper jaw didn't grow enough, or the lower jaw didn't grow enough, or the lower jaw grew too much. And so now you have a mismatch between the upper and lower jaw. What orthognathic surgery is working in consultation with the orthodontist. The orthodontist gets the teeth straight, and then we take the patient to the operating room and we do surgery to break the upper jaw bone or lower jaw bone, or both, and get the bones aligned, which aligns all the teeth. What makes this office so unique with orthognathic surgery is usually when orthognathic surgery is done, it's done with the main operator and his assistant. So there's usually two surgeons involved with surgery, and that's just because of the complexity. Dr. Gesek and I have been partners now for 23 years. So we've been doing orthognathic surgery as a team for 23 years. We do more orthognathic surgery than any practice in Northeast Florida by far. The treatment process for orthognathic surgery is much more complex than taking out wisdom teeth or even doing implants. It's quite a long process. There's usually 6 months to a year of orthodontic treatment done by another orthodontist before the surgery takes place. We go over everything with the patient over several months before surgery so that there's no surprises. They know exactly what's happening. So then when they actually go to the operating room, they're not thrilled to be there, but they're prepared. They know what to expect. And then they also know what to expect in the recovery, because the recovery is a lot longer for orthognathic surgery than it is for simply removing teeth. Usually they're in a non-chewing situation for approximately 6 weeks after surgery. We don't wire anybody closed anymore after surgery like we did in the late 80s and early 90s. So right after surgery they're able to open and close their jaws, but they're not able to chew anything because their jaws are being held together with bone plates and screws. And they're strong enough to allow them to open and close, but they're not strong enough to allow them to chew on a hamburger. So they have to eat pretty much a blenderized, non-chewing diet for approximately 6 weeks afterwards.